Well, good evening, everyone. Thank you so much for joining us for today's State of Mental Health in North Carolina Town Hall. My name is Amy Brundle. I'm the Director of Marketing and Communications for NAMI North Carolina. And we want to especially thank just all of our esteemed speakers and panelists today, but especially the team from North Carolina Department of Health and Human Services for helping us put this together. Um, just a couple of housekeeping notes as we have people still trickling in. If you have any Q&A or if any questions for any of our speakers, you can put them in the Q&A section at the bottom. You can also use the chat function, but the Q&A will help us keep all of our questions organized. Also, if you have a particular speaker that you would like to aim your question towards, please include that so that we can filter those accordingly. Also, this session will be recorded and up on the NAMI North Carolina YouTube channel tomorrow. So you will be able to see it, especially those of you who might not have been able to join us live. You'll be able to see this recording in full by tomorrow afternoon. So without any further ado, I'd like to introduce my Executive Director, Holly Doggett. She's been with NAMI North Carolina for about a year and a half, a little over a year and a half. But that does not at all describe the decades of experience that she has in public service, in nonprofit management, and in mental health in general. She is a peer and a family member, so she comes with a unique experience, lived experience, dealing with mental health issues, with the systems that surround us as we try to navigate mental health issues, and how to help other people navigate those systems. She's been an excellent mentor and boss, and she will provide a lot of great insights in this presentation and other ones to come. Holly, I'm going to leave it to you. Thank you so much for being here.
Thank you so much, Amy. On behalf of NAMI North Carolina, it is my pleasure to welcome all of you this evening. Thank you to all of our panelists. I can't begin to tell you how much we appreciate you giving your time, your expertise, and also your passion to the field of mental health. You really are driving the future of mental health in North Carolina positively into the future, and we so appreciate that. I'm absolutely not going to take up too much of your time this evening with the welcome, because I have the pleasure of turning it over to, if you will, the brainchild of tonight's panel, along with the Department of Health and Human Services, Mental Health, Developmental Disabilities, and Substance Use Services Division. So I am going to take a moment to introduce the amazing Lillian M. Davis. Lillian is the Director of Public Policy and Advocacy here at NAMI North Carolina, and I know many of you already know her. But for those of you who don't, Lillian has traveled for over 27 years across North Carolina, advocating for mental health, public policy, teaching diversity and leadership, and fostering leadership skills in emerging leaders. As a matter of fact, one of her interns is joining us this evening. Her previous professional roles, she's the former executive director of NAMI Wake County, one of our NAMI affiliates. She was the league director of the Junior League of Raleigh, director of business development for Pride in North Carolina, regional director of business development for strategic behavioral health, regional intake director for NC Mentor, and I know a role she's especially proud of, a special education teacher at West Clayton Elementary School. She is a very proud graduate of North Carolina A&T State University. And with that, I am going to turn it over to Lillian to get us kicked off this evening.
Thank you, Holly, to the most amazing executive director ever. You always trust me, you give me support, and you help me make things come into fruition. Thank you, Holly. So why are we here tonight? As you all have heard, NAMI North Carolina represents one of the largest organizations that helps to make sure that those who have mental illness or have a loved one that has mental health issues or concerns has a voice at the table. NAMI started from just a conversation at a kitchen table by two mothers, and years later, we are here advocating more than ever before. It is important that we remind you that NAMI North Carolina, we do provide education, support, advocacy, and public awareness. But most importantly, we have been the voice for those who have been unable to sit at that table. I take it as my charge representing the state of North Carolina as I sit at that table and I represent all of you, not only tonight, but when I go to the General Assembly. How this webinar started, it was just that, a conversation with Director Kelly Crosby. I asked her to breakfast and I told her I have another idea for you. And just the type of leader she is, she didn't hesitate. And 2 days later, I had a breakfast meeting with her. I walked into that meeting with a Post-it note, and today is our webinar. So it is my honor to come today to introduce the most amazing director, Kelly Crosby, who is the director of the North Carolina Division of Mental Health, Developmental Disabilities, Substance Use Services. Kelly Crosby brings over 30 years of experience in providing and managing public services and the support for people with mental health and substance use issues, intellectual and developmental disabilities, and brain injury. Kelly oversees the public community-based system for mental health, intellectual and other developmental disabilities, substance use, and traumatic brain injury in North Carolina. For the past 13 years, Kelly has served in multiple leadership roles with the North Carolina Department of Health and Human Services, including Assistant Director of Behavioral Health at North Carolina Medicaid, Chief Operating Officer of North Carolina Medicaid, and the Chief Quality and Population Health Officer at North Carolina Medicaid. Kelly is proud to be a licensed clinical social worker and a person with lived experience. It is my honor to introduce to you my friend, our biggest partner, our biggest voice in this industry, Director Kelly Crosby.
Thank you so much, Miss Lillian. That was really kind of you to say all that. And thank you to Holly as well and to Amy. It is really a pleasure to be here with you tonight. And so that was a really big introduction with a lot of words. But this is what I like to say about folks who don't know me. So 3 things. I'm a mom because I really like being a mom. It is my favorite thing. It's my favorite role in the world. I'm a social worker. I'm super, super proud to be a social worker. And I'm a person with lived experience. And one of the great pleasures of my job is to work with NAMI. Every single time I get to go to a NAMI event, whether big or small, I get to connect with people who have stories very much like mine, who have a loved one, many loved ones, with mental health issues that have vastly shaped our lives. And I'm so eternally grateful to the NAMI team for what they do every day for the citizens of North Carolina and for our families and for me. So it is a pleasure to be here tonight. And, you know, when Lil and I met for breakfast, one of the topics of our conversation was obviously the policy changes that are happening and our concern that people would be discouraged and feeling kind of hopeless right now. And that's a really, really bad way to feel. And I love that. All credit to Miss Lillian for lifting up the idea of a town hall. And I said, absolutely, let's do it. But I say that anytime Miss Lillian says anything, always. She has the best ideas, and they're always the right ideas. So I'm really happy to be here tonight. I prepared a few remarks, but there's so many amazing speakers here tonight. So I'm going to try to be succinct, which is not my strong suit. And hopefully we'll have some time too for some questions from the audience. So let me just start with a bit of a framing conversation about some of the things that folks are really worried about right now, because I think that's only fair and it's only genuine. We know that there's been a lot of changes because of HR 1, House Resolution 1, also known as One Big Beautiful Bill, that will impact Medicaid. It will impact people with having to reapply for Medicaid. It will impact people with work requirements. And we just know from other states, not trying to be doom and gloom, I'll get to the positive stuff. We know from other states that often this means people with serious mental health issues or substance use issues find a hard time maintaining their Medicaid. It's a lot of barriers and they're not interested. And so people lose Medicaid. One of the things we're particularly proud about in the past 18 months, and we've seen enormous changes in our system already, are folks who were able to get Medicaid through Medicaid expansion. And we quote these numbers all the time. 40% of the people who were getting services with just state dollars had Medicaid, which is extraordinary. State dollars don't go very far when you're looking for mental health treatment or substance use treatment. So to have Medicaid and get a really whatever you need and a continuum of care for as long as you need to support your recovery or your loved one's recovery was pretty extraordinary. So we want to do everything we can to make sure that folks are able to maintain their Medicaid. The other thing that came out on Friday, I don't know if folks noticed, and the timing of it was pretty brutal. Last month, we celebrated the 30th or the 35th, am I getting my dates wrong, y'all? Anniversary of the Americans with Disabilities Act. And we had a phenomenal celebration here in Raleigh. We had lots of people with lived experience. So folks who are blind, hard of hearing, people with intellectual developmental disabilities, and people with serious mental illness. They came forward to tell their stories of how they had been, institutionalized or put in situations where they couldn't live in a community and they were told their whole lives, you're going to be sick and you're going to need treatment your whole life and you should just go on disability and not get a job. How their lives are fundamentally changed when we view people with mental health issues as us, because we are us, and that there is hope and there's recovery and there's healing, and our inclusive world should include people with serious mental health issues. And we should do our very best to make sure that our housing and our healthcare and our schools and our education and our workplaces include people with disabilities of all kind, including people who have serious mental health issues. So it was a joyous celebration. It truly was about how far we've come. I myself, probably like many of you on the call, I had a great uncle who was institutionalized, and that was just expected. There was never even any consideration that he could live in the community on his own with support. So it wasn't even a thought. The only thing that could happen to him was to be institutionalized. So we've come really far, and I want to make sure we keep going far. So right after the ADA celebration, an executive order came through the federal government, and I've got to touch on it. We're going to be sending out a hot topics on it because it was an executive order that made a lot of folks feel uneasy and quite nervous. It was talking about public safety and people who are unhoused, and it linked people who were unhoused to people that had mental health issues and substance use issues. And it really called for more involuntary commitment and forced treatment. And that's really kind of nervous making. And it's not where we want to go. And it is the exact opposite of the ADA. So I'll be sending something out to the community just to reaffirm our commitment that people who have mental health issues are not scary. They're not frightening. They're not criminals. They don't need to be involuntarily committed, have their rights stripped away. We give them medication against their will or treatment against their will. That's not the world that we need to have. We want to support our loved ones. We're all here because we have loved ones with serious mental health issues. But we know that there are better, more humane ways to support their recovery. So we're very committed to that. So let me talk about the positive stuff, okay? So that's kind of the downer stuff. But the positive stuff is we're still staying the course. Don't you worry, we absolutely are. There's no doubt about it. We've got incredible support from our governor and our first lady, our Secretary of Health and Human Services. In our division, a year and a half ago, we set up our strategic plan, and we are going forward on our strategic plan with no changes. So just as a reminder, some of the things we are working on, and remember, the whole point of the work we're doing is to make sure that North Carolina has the best system of services and supports for people with mental health, substance use, intellectual developmental disabilities, and traumatic brain injury. I'm going to hyper focus on mental health, though, because I'm talking to my NAMI colleagues today, okay, my NAMI family. Just to remind you some of the things that we're working on to improve mental health care and access here in North Carolina. The first thing we are still very committed to is just improving access. And for us, that means reducing stigma. People with mental illness are not scary and unhoused and people you should be afraid of. They are us, 1 in 4 of us, and our families and their loved ones. And so we're trying to do a lot to reduce stigma, but we're also trying to make sure we have better access in communities that are marginalized. It's an important thing to think about in July when it's Minority Mental Health Month, but that means we are continuing our commitment in our services to older adults, to veterans, to BIPOC communities, to Latina communities, to individuals who identify as LGBTQIA+, to faith-based communities, to veterans, to everyone. But those are unique groups that I mentioned, groups that don't often get access and maybe need access in a way that is more culturally appropriate than coming to our treatment centers. And that's okay. So we're going to continue our partnerships with communities. One of our big partners is NAMI, y'all. We love NAMI. And we're going to continue our support of family caregiver organizations. You hear me say this all the time. People may go to treatment. Treatment is an hour, 2 hours a week. They actually spend the rest of their time with their families and in their communities. So we need to make sure that we have strong communities, strong churches, strong supported families, so people get all the support that they need for their recovery. So we're going to continue our support of organizations like NAMI that support community, and NAMI on campus, which we absolutely love as well. We're going to continue to work on our crisis system. So remember, hopefully everyone is getting to know 988, and we want people to know there's a safe, anonymous place to call. No one's going to ask your name. No one's going to look up your insurance. No one's going to send police to your home. It's free and it's safe. And it's just a lifeline for you to call for any reason. So we'll keep promoting 988, keep trying to make it stronger. And we'll keep promoting our alternative mental health and substance use crisis system. So when you're in crisis, you can have a mobile crisis team come to your home. You don't have to call 911. You can call 988 and they'll send a crisis team to your home, which is a clinician. You can go to a crisis center, which is staffed by mental health professionals instead of going to an emergency department. And we're encouraging, with NAMI, our continued partnership with law enforcement. So law enforcement know how to respond in situations where someone has a mental health or substance use need. And they also know where these crisis centers are, and they can take folks there and drop them off so folks aren't getting arrested or going to jail. So we're still really focused on improving the crisis system and the crisis system experience. It has to be a good experience for people when they call or when they go to a crisis center. We're still really focused on our justice-involved populations. And for us, that means in as many counties as we can, trying to have diversion programs. So when people with mental health or substance use needs interact with law enforcement, they can be diverted to treatment instead of being arrested. Or if they are incarcerated, when they come out, we can help them with strong reentry programs and things like transitional housing, supported employment, and peers who maybe have their own experience in the justice system. So we're still really committed to making sure, as much as possible, we're making sure that people get the treatment they need, because we just know that so many people who are currently incarcerated have mental health issues and would be much better served in the treatment system rather than in jail. And please hear that in no way as being anti-law enforcement. We love our law enforcement partners. They are critical partners in this work. And we want to empower them to do their role and make sure we're taking care of our role to really support people with mental health issues. And lastly, another big focus for us in the mental health space, just to remind you, are the kiddos. Okay? Our goal in our division focuses a lot on kids who are in crisis, but also kids who end up in emergency departments and in out-of-home care. We are doing a lot to improve out-of-home care treatment settings. You're going to see some big announcements soon, including some in-state specialized treatment options. But our goal, honestly, is to make sure that kids go out into out-of-home treatment rarely. And when they do, it is a highly therapeutic, warm, welcoming stay. And they're able quickly to return to the community with wraparound services for them and their family. So working on a variety of things there. So what I would say in summary is just wanted to remind you of some of the things that we're working on. That's not all the things that we're working on, but none of that has changed. So we will, of course, respond as we always do. And I say this to all of you, right? You're our community. You're my community. You're my partner. We are the most resilient people that I ever met. When has our mental health system not been in some sort of turmoil? It has. But every year, when you think about the ADA, and you think about how life was 50 years ago for your parents and my grandparents, it's better. And it's going to keep on getting better. And we just have to keep working, and we're going to do it. We're going to be okay. But I'm glad to be here tonight, and I want to assure you that we are definitely staying the course and appreciate your partnership. All right,
Thank
Ms.
you.
Lowe.
Thank you, Director Crosby. You've been busy. You continue to be humble, and you're in it to win it. We thank you for all of your support, the ability to listen and to take action. And that's what I know most about you. Thank you for joining us and for supporting this webinar tonight. As a grassroots organization, we want to give you just a tidbit of my experience as a now registered lobbyist for North Carolina. So I had the opportunity to work with two specific legislators who have entertained me tonight to join us to talk about those two pieces of legislation and to just share what the experience was like for me to do this for the first time to represent NAMI North Carolina. They ensured from the beginning that NAMI was at the table. He is a good friend. He's my fraternity brother. Representative Zach Hawkins is here tonight. He represents Durham County and has been recognized as one of the most significant young political leaders in the state under 40 when he was named on North Carolina Central's list. I'll forgive him for that in 2018 for the 40 under 40 honoree. He has served in leadership roles at the local, state, and national levels, and most recently as the first vice chair of the North Carolina Democratic Party. In this role, he was able to see several plans to fruition, including his initiatives to increase voter registration and fight voter suppression. He is a proud graduate with a degree in biology from Elizabeth City State University and a Master's of Science in Biology from North Carolina Central University. He served as a teacher in Durham Public Schools and has worked every day to help remove financial barriers for those who need it most. As a development and advancement professional in nonprofits such as United Way and higher education institutions like East Carolina University, Duke University, and UNC, few causes are closer to his heart. But most importantly, he is most happy to say he lives in Durham with his wife Tracy, his son Zachariah, James Preston, and Adam, and a golden retriever called Sophie. To you, my great fraternity brother and my friend, Representative Zach Hawkins, will come before us tonight and talk about a piece of legislation that NAMI support and help support him this year through the General Assembly session. Representative Hawkins, the floor is
Well,
yours.
yeah, thank you so much. I really appreciate the opportunity to join you all this evening. Thank you, Lillian. Yes, you are an amazing friend, a sorority sister, but most importantly, you're a passionate advocate for mental health supports for people around the state of North Carolina, and we need more people like you in these spaces because this is an issue that we cannot let fall to the wayside. You started your program off with the perfect person, Kelly Crosby. She is the go-to. I also happen to chair the IDD caucus, and so the willingness to be available to talk about this issue and the issue of mental health is right down her path, and she is an expert. She is the best that we have to offer, and so you got a treat, and I know you will continue to get that treat later this evening. But there are two things that she said that I'll piggyback on. First is that we need to make sure that stigma at all levels is eradicated. We're starting to see it, a little bit better for those in the younger population, those in high school and college. They talk, they're more interested in seeking therapy, and are more willing to talk about their feelings. Much better than those who are a little bit older than I am and in my age demographic. And so we're proud of them, and we need to continue to make sure that people are okay with seeking help. I come to this space, as she said, as a dad, but also someone with lived experience, as a family member, and friends that I have had mental health and severe mental health issues. And so this is a passion of mine. And it's something that in the General Assembly, in many ways, that we have supported by trying to ensure that we did expand Medicaid, which gave people access to care. We're still hoping to make sure, regardless of what's happening with the One Beautiful Bill, that we do that. Also, more, fighting for more psychologists in schools. But then most importantly, making sure that organizations statewide that are doing the work directly with people get the resources that they need. But tonight, what I'll do before I hop on, actually, I'm going to one of our fraternity is having a panel that I'm on to talk about getting involved and people getting involved locally. But before I go, I do want to talk about House Bill 551, and that's the clubhouse expansion bill. As she said, Nami was at the table, very helpful to make sure that we knew how we were moving forward, and what this bill meant. And so, just for those that are not familiar, the bill is a transformative piece of legislation that aims to expand access to psychological rehabilitation for North Carolinians living with severe and persistent mental illness. The bill directs DHHS to create a statewide reimbursement plan for behavioral health services provided through Clubhouse, the Clubhouse Model Day program, a proven community-based approach that supports mental health recovery through employment, education, and peer support. The things that a few key, provisions. Again, as I said, it makes sure that these groups are accredited by Clubhouse International, which is a gold standard in the field. It really highlights education and training for local mental health management agencies and state officials to better understand how to support the Clubhouse model. Um, and and whilst always important in the General Assembly is $2.5 million recurring to fund existing and new accredited Clubhouse professional developments and expansion statewide. And the reason that we should continue to fight for all mental health services, but in my mind specifically, this is a real lifeline for people that are living with serious mental health illness. These clubhouses just aren't buildings, they're communities. They empower individuals through structure, dignity, and purpose to make sure that people return to work, get education, and something that's really important is independent living. In a time when emergency rooms, as Kelly mentioned, and jails are often the default response for mental health crises, Clubhouse is a proven model that's cost effective and most importantly humane. And so, I think that we need to ensure that there's equity and access to mental health care, no matter where you live. You shouldn't have to live in Durham or Raleigh or Chapel Hill or Charlotte. You should be anywhere in North Carolina. We have to make sure that we're reducing the hospitalizations, homelessness, as you mentioned, and incarceration of the most vulnerable. We need to understand Durham has done a good job with their heart program of sending out, medical professionals, those with psychologists, mental health workers instead of and accompanying law enforcement, so that we can get better about ensuring that those who are in crisis are not incarcerated first. And so, for me, this, policy is not just policy, it's about people. And I'm hoping that North Carolina, really moves in this direction. I won't give up on it. And as Kelly mentioned, things like this are really powerful, step towards, access. And but at the end of the day, with the changes in Washington, we have to ensure that there are state dollars to support Medicaid expansion. That is one of the best things that's been told. If you want to help people with IDD, expand Medicaid. If you want to help people with mental illness, make sure that there's dollars there. And so, without strong state support, the promise of the big beautiful bill falls short. And so this thing, Clubhouse and the Clubhouse model can only serve those who have access to care, right? And so we have to make sure that there are resources. And so if we're serious about transforming mental health in North Carolina, we have to fund Medicaid. We have to remove outdated barriers, which I know Kelly can tell you all about. And we have to, and I think most importantly, treat people who are going through mental health crisis and have a history of mental health illness with the dignity that they deserve. And so I believe in a better North Carolina. I still believe that where the weak grow strong, when the strong go great. And when you find those who are weak, we have to do the work of making them strong. And that's what this bill does, and that's what expanding Medicaid does. And so I'm so grateful for the opportunity to hop on and talk about the things that I'm doing in this space and that we're doing as a General Assembly to help move the ball forward and introduce this and make sure that our colleagues in the state can be better. We can leave it better than we found it. And so I'm about to hop on another panel, but I'm so grateful to you. And I just hope that everyone spreads the word about what we can continue to do to support mental health and mental illness across North Carolina. Thank you, Lillian.
Thank you, Representative Hawkins, and we'll be here to support you. As we continue our journey tonight, we have A few different categories we're going to cover, mainly mental health initiatives, but we wanted to make sure that you heard from the most important category in our actual webinar tonight, and that's from our government officials. So it is my honor that we will have some updates from our governor's office, our Department of Justice, the Attorney General's office, our public schools. We will also hear from our county manager, who will talk more about affordable housing and reentry. And then we will come back to another powerful legislator who we've had the experience of doing some actual legislation work with. So now I will introduce our next speaker tonight. She is no stranger to many of you, but she is Amber Harris. She is the Deputy Legislative Director in the Office of Governor Josh Stein. Amber Harris currently serves as the Deputy Legislative Director in the Office of the Governor, our Governor, Josh Stein. Prior to this role, she served as the Director of Policy and Advocacy at the North Carolina Association of County Commissioners. She is a North Carolina native and currently resides in Durham, and a good friend and partner for NAMI North Carolina. Deputy Director Harris, we're happy to have you tonight. The floor is yours.
Thank you so much. And thank you so much. These are very August, very beautiful introductions. I'm living for them. So thank you so much for that beautiful introduction, and your beautiful introductions of everyone, and for having me tonight. I've been reflecting a lot as Director Crosby and Representative Hawkins were talking, and on behalf of Governor Stein, I think a lot of what I'll say is ditto. We remain committed to improving access to mental health in our state. And a lot of the work that I think we're doing right now is to mitigate some of the harm done by, I won't call it the big beautiful bill, I'll call it the Reconciliation Act. Mitigate some of the harm done by the Reconciliation Act, and also some of the underinvestment and delay in funding at the General Assembly. So shout out Representative Hawkins and Senator Tedros for their dogged advocacy in mental health. I was also reflecting about what Kelly said about being a person with lived experience, and how when we talk about people with mental illness, with severe mental illness, I think a lot of times what holds up real investment and real advocacy and real change is that we think about these people as those people, when those people are our people and those people are us. If you don't think you know anybody who's struggling with mental illness, that is incorrect. These things are impacting all of us at various different levels. So those are my immediate reflections. And I'll also say one more thing, because this is the evening of compliments. I'm so appreciative and impressed by the depth of expertise and passion by folks at DHHS. The folks at that agency work so hard, and their depth of expertise and the understanding they have of context of mental health in North Carolina is just amazing. And I'm always really, really impressed. So like Lillian said, before I came to the governor's office, I spent 10 years at the North Carolina Association of County Commissioners. And I ended my time there as our Director of Policy and Advocacy. And I spent a lot of time talking about the need, advocating for additional support for counties to provide mental health services. And also sort of part of my work was to bring groups of people together who could think creatively about leveraging existing resources. So really grateful to be here with you all tonight and share a little bit about what the governor's office is working on. So ditto everything Kelly and Representative Hawkins said. And I'll just kind of run through some of the things that the governor has been working on. And I'll start with his time as Attorney General, because there's a linkage here with my time at the County Commissioners Association. I think Kelly and maybe Representative Hawkins mentioned too that mental health disorders and substance use disorder are actually linked. And what was a huge deal when I was at the County Commissioners Association was the negotiation of the multi-state opioid settlement. That really was a boon for counties to begin to address some of the very real consequences of the opioid epidemic. There's still a lot of work to do, and the funds from that settlement are finite. But I'm really grateful to see, again, some of that creative, collaborative thinking that counties are doing around this issue. Additionally, the reentry work that counties are doing and that the governor supports in, and also frustratingly supports in having a warm handoff, in making it easier and making it less difficult for people to transition from incarceration to not being incarcerated. I'll also add that the governor proclaimed May as Mental Health Awareness Month, and really getting at that like destigmatization of mental health disorders. Like we all have had something going on or have a relative or a loved one who has something going on. So really understanding that mental illness impacts us all and that mental health is physical health. These things go together is really, really critical. The governor has started a task force on student well-being, particularly focused on student mental health and the impact of devices on student mental health. I know the pivot from opioid use disorder to cell phone addiction may be a little awkward, but these devices and the addiction to these devices that a lot of children, a lot of us also probably have are really impacting student well-being and youth mental health. So really focused on that. There was a bill that we signed into law. We were very excited to sign into law. Senate bill, House Bill 231, the Social Work Licensure Compact. I know Kelly says she's a social worker. I don't know who's in the audience, but I imagine there's a lot of social worker energy. My mother was a social worker. I love the work that social workers do. And so we're really gratified to see that to sign that legislation into law to make it easier for social workers to work across states and maintain their licensure when they move. We also know that there is a dearth of social workers in this state. And so hopefully the signing of this bill increases access for people in need of services. We also, like I said, we're focused on mitigating harm caused by Medicaid, cuts to Medicaid and insufficient funding by the General Assembly. And then Amy also asked me to provide a little update on some bills that the governor vetoed. I'll talk about a few that I think had some particular mental health implications. I'll start with House Bill 805. This is a bill that had that defined two sexes in state law. We vetoed that bill. Ultimately, we were not successful in sustaining that veto. So that was a lot of a bummer. But what this bill really amounts to a kind of calling out of people who are really in need of more support. So any legislation that harms people, that calls them out, that makes them targets, we're not for that. And so we're glad to veto House Bill 85 and sad to see that 805 and sad to see that veto overridden yesterday. I'll also talk about House Bill 318. This is a bill that requires notification of release to immigration to ICE when somebody in a county jail has an immigration detainer. Now, like Kelly said, Kelly also mentioned being supportive of law enforcement, and the governor is a former attorney general, right? Like arguably the state's top cop. And so we are not interested in making it easier for people to commit crimes or people who commit crimes not facing justice for those crimes. However, some of this legislation that we've seen in the General Assembly over the last few sessions is really sort of anti-immigrant. And the impacts of that are that people feel alone, people feel afraid, people feel scared, which is a mental health issue. But additionally, people who may be suffering from severe mental health issues are disinclined to seek services. And so that creates a sort of a vicious cycle. We were also not able to sustain that veto. I wish I had better news for y'all. I really do. We were also not able to sustain that veto, but wanted to make this group of people aware of the governor's sort of sentiments on legislation that ultimately amounts to bullying, and wanted to express that we understand the impacts on mental health sort of across the spectrum. that I think is all I have. We so appreciate this organization's support and advocacy. I'll say I met Lillian at the NAMI legislative breakfast. I don't know, when was that, Lillian? Like April, March? I had just started
April.
April, and was so impressed by her and additionally all the other advocates in the room. Everybody was very warm and very welcoming and very willing to share their experiences. And I was like floating from that breakfast all day, and it was at 7:30 a.m. So I was really floating if I felt good after that, because that's basically dawn. But it was a pleasure. It was a pleasure to be there. I'm so glad I was able to make it. That's all I have. Again, my name is Amber Harris, Deputy Legislative Director for the Office of Governor Stein, and happy to be a resource however I can, whenever I can. Thank you so much for your time.
Deputy Harris, I will tell you, a delay is not a denial. You will continue to get letters of support for our governor to the governor's office. NAMI is a grassroots organization, and we put the act in action. So if there's anything else that you or Governor Stein need, you let us know, because we know how much a person's voice can change the dynamics of a situation. So you call on us if you need us. We're taking advocacy. Director Crosby and I agree to the next level. So you let us know.
Come on, Lillian. I love to hear it. Thank you. Thank you.
You're welcome. As we continue, we're going now to our North Carolina Department of Justice. I have a dynamic individual with me tonight. I met her once or twice, and now I get to know her official title. It was a secret at first, but now I get to introduce her tonight. Natalia Botea is the Special Deputy Attorney General, Co-Director of Public Protection Section for the North Carolina Department of Justice. She is dynamic. As a director of the Public Protection Section, she leads a team working on policy and public engagement initiatives for the department. She previously worked as a policy advisor for the Office of Governor Roy Cooper, where she focused on public safety issues, leading efforts to align state agencies and departments with the governor's goals and priorities. Prior to her time in state government, she was attorney at Charlotte Center of Legal Advocacy. Botea earned her undergraduate degree in public health and her law degree, both from UNC Chapel Hill. Go Tar Heels. Ms. Botea, thank you again for all of your support. We are excited for you to be here tonight. It is your turn.
Thank you so much, Lillian, and good evening, everybody. Thanks for including us in this conversation. I think we are a smaller part of this larger puzzle. So I'm going to spend a little bit of time just diving in and talking a little bit about what the Department of Justice does. I think most people have heard of it, but not many know kind of the purview of what we do. And then I'll highlight 3 areas where our work is intersecting with the mental health system. And excited to have our new Attorney General, Jeff Jackson, on board, and he sends along his regards tonight. So the work of the Department of Justice really, to me, fits into 3 kind of major buckets. So first, we have our services to state agencies, where our lawyers represent every state government agency, including the Department of Health and Human Services. Second is our criminal division, and I know Kelly touched on the intersection of kind of the mental health system with law enforcement. So our criminal division really works on preventing crime and supporting law enforcement. So that's everything from representing the state in criminal appeals, prosecuting cases at the request of local district attorneys. We house our state crime lab. And also, I think relevant to this discussion is we house the North Carolina Justice Academy, which is responsible for training law enforcement across the state. And that includes some training that we are doing on the mental well-being of first responders. And I know that's an issue that Attorney General Jackson is really passionate about. So if anybody out there is really working on that issue, would love to connect more with you about that. The criminal division also houses the Medicaid investigations division. So in addition to investigating fraud in the Medicaid system, we also have the ability to investigate and prosecute abuse of people in Medicaid funded facilities. And since almost every facility is a Medicaid, accepts Medicaid dollars, that gives us very wide latitude to investigate patient abuse, which I think is something a lot of people don't necessarily know that we do. And then last but not least, the third part is our consumer protection division. So Amber mentioned the opioid settlements. Those are the teams of attorneys that have done everything from kind of the opioid litigation, Juul litigation, our Meta lawsuit, as well as receiving and reading about 20,000 consumer complaints that we get each year on all types of bad business practices. So if you don't know that we accept those complaints, please check out our website. Anybody in North Carolina can submit a complaint about a bad business practice, and we do read and review all of those, try to negotiate with businesses if we can, and then look for patterns and can take action against businesses on behalf of the people of North Carolina. So 3 areas I wanted to highlight in particular that may be of interest to this group. So the new Attorney General has really hit the ground running, and obviously he's taking office in a very unique kind of political environment. So in April, we sued the federal government over their withholding of $230 million in federal funding. Much of that federal public health funding flowing through DHHS, most of it to local health departments and programs. A lot of that was funding for substance use disorder treatment. Some of it funded, collegiate recovery and treatment programs, as well as other kinds of like public health tracking, surveillance, all of that kind of stuff. So we won our preliminary injunction in that case, and we're awaiting kind of the next steps in the litigation there. But that was an early initial win. Second, what a lot of people may have heard about just a couple weeks ago, we also sued the Federal Department of Education for illegally withholding $165 million for North Carolina K through 12 schools. And after we and others filed suit, the Department of Education reversed course, prior to the first court hearing. So that was a big win for North Carolina students that are getting ready to start school. And then a little bit of a different track, I wanted to mention our litigation against Meta, as well as some other social media platforms. So Amber touched on this kind of from the policy angle and the governor's task force. But the North Carolina Department of Justice is engaged in a lawsuit leading a bipartisan coalition with attorneys general in a number of other states, suing Meta. I mean, as Amber mentioned, we know a lot of people and a lot of kids are spending too much time on social media, and that's not always good for mental well-being. And kids are also being exposed to a lot of dangerous content, whether that's, sexually explicit content about cyberbullying, eating disorders, substance misuse. So, I mean, our lawsuit alleges that Meta broke federal and state laws by targeting and addicting kids, and also kind of minimizing information about the harm of social media. So all of that work is ongoing. And yeah, again, we're just kind of a smaller part of this larger picture. We're not on the front lines like our partners at DHHS, but just wanted you to know that you have an attorney general who cares very deeply about the health and well-being of all North Carolinians and cares a lot about the mental health community. And I'll put both my work contact information in the chat, as well as some of the like major ways you can reach out to us, whether it's filing a consumer complaint. We also do outreach presentations. So if you're a part of a group that's interested in a presentation, our bread and butter is kind of the consumer protection, scams and frauds, but we have some other topics as well. And thanks again for the opportunity.
Ms. Botea, you are the action for the state of North Carolina. We're excited. We're excited. I know of one person that's excited on this call, at least tonight, but we just thank Attorney General Jackson for all he's done. He is humble, but he does not play. And I love it. And we here want results, and we know how powerful education and other mental health initiatives and funding is for our state, because we are top of the line. So thank you for all of your work and just your voice. And to meet you personally, you are just a blessing. So thank you for being here in North Carolina, and we'll be here to support you as well moving forward. Thank you again for representing tonight. And now we'll move forward to Our Superintendent of Wake County Public Schools. It is my honor to introduce tonight Dr. Robert Taylor. Before briefly serving as State Superintendent of Education in his home state of Mississippi, Dr. Taylor spent 2 years with the North Carolina Department of Public Instruction as the Deputy State Superintendent. In this role, he supervised several areas, including federal programs, North Carolina Visual Public School, school operations, and school nutrition, while also working closely with the State Board of Education and Superintendent on Mission and Vision Development, legislative and policy development, and program implementation and evaluation. Dr. Taylor served as the superintendent of Bladen County Schools for nearly a decade. He was named the 2017 Sandhills RESA Superintendent of the Year and the 2018, I'm going to get this right, Dr. Taylor, NCAAHPERD Superintendent of the Year for his work in school nutrition, health, and physical education. He was also awarded the Friday Medal in 2017 from the North Carolina State University's Friday Institute for Educational Innovation and received the Friends of Nutrition Award from the North Carolina Child Nutrition Association in 2018. In addition, he has served as an advisor to the Schools of Education at the University of North Carolina at Pembroke and Federal State University. Dr. Taylor received his bachelor's degree in history and political science from the University of Southern Mississippi. He obtained a master's degree in school administration and a doctorate in educational leadership from Federal State University. It is my honor to introduce the most amazing superintendent of schools, Dr. Robert Taylor. Dr. Taylor, the floor is yours.
Thank you, Lynn. I appreciate the opportunity to talk with NAMI tonight, and I appreciate you guys putting on this forum. I know I only have a few minutes, so I'll try and get through what I want to share about the budget and really how it impacts the mental health status of children in our schools. And so, when you mentioned that there was a happy person on the call tonight, I assume you were talking about me when that funding was released. And we do thank Attorney General Jackson and the work that they've done to get us there. And so, briefly, just to think about my role as superintendent, my biggest job really is to focus on teaching and learning. But I also recognize that work cannot be done when we don't have an adequate and balanced budget. And so, while everything is about teaching and learning, we absolutely cannot do that work when we don't have the proper funding. And one of the things I always like to share with anyone who's willing to listen about the nature of school budgets is that those budgets really are threefold. They do not come as a budget at one time and we can plan things out and move forward. But they do really come at three different times. So we're talking about our local budget, our state budget, and our federal budget. And the local represents about 35%. We do think our county manager, David Ellis, who's on the call now, one of our prime benefactors. We appreciate that. And we get about 55% of our budget from the state, and the remaining 8, 9, or 10% from the federal government. And so what we try and tell people is that these budgets arrive at different times. And so that means that we have to try and determine what the outlook is going to be like and plan all of that out, even though we know that school starts in August. And so that budget reconciliation really doesn't come until about the January timeframe. And so anytime that we have a disruption, that can create a tremendous amount of unrest and unnerve for a school system. And so when we think about all of the things that are impacted by budget cuts, these are the things that I really think are critical that I want people to understand, that there is an overall impact when we talk about those reductions. And so if we think about the daily operations of a school, obviously, maintenance and operations are part of the budget process, being able to hire people. But I also want people to recognize that there is a clear connection to the well-being of students, both from a mental health perspective and a nutrition perspective. And so we rely on that funding to make sure that we can provide those services that allow children to be able to fully participate in an educational program. And so one of those issues where we've absolutely had a tremendous impact is the cancellation of one of our federal mental health grants. And so we're talking about a $14 million reduction that was going to be used to provide additional personnel to provide that badly needed mental health and social emotional support that our students need. We are also waiting and trying to determine what is the impact of the Medicaid reduction, because most people may not recognize that there's a direct impact on schools, because we participate in what we call MAC reimbursement, a Medicaid reimbursement. And so when there's a reduction in these funds, we're not for sure what the impact may be on our public schools. So that is something that is a tremendous impact in terms of budget cuts and budget reductions. A lot of what we get is also money that supports what we call compensatory education services, and that being Title I services, exceptional children or special education services, and funding that we use to support low-performing schools. And so anytime that we have those type of cuts, it really does impact how we're able to do the work. But more importantly, when we think about budget cuts and the impact that it has on mental health and social emotional practices, our number one priority, as we talk about, is teaching and learning. And so when we have to engage in budget cuts, and quite often that is going to lead to personnel being cut. And normally it is that mental health or support services that are the first to go. And so we recognize that we have to have a teacher in a classroom. And so when districts have to choose between teaching staff and support staff, there's going to be a huge impact on that support staff. Doesn't mean that we cut them all, but it absolutely means that there's going to be a reduction in the services that we provide, and it makes it that much more difficult. And so I can't say enough about the importance of mental health, social emotional well-being, and nutrition. Because what we recognize is that when students can't focus on mental health, when they come to school hungry, when social emotional issues are there, they absolutely cannot focus on learning in the classroom. So that's why we know that is necessary. And so just to kind of wrap it up, because I know we're running out of time, I do want people to understand when we have these budget cuts, it creates what we call uncertainty. So imagine having funding that we're expecting to be released on 1 July, and you find out on the 30th of June that funding has been suspended and may be cut outright. And having to pivot on a dime, that is something that's extremely difficult to do. And so think about the emotional stress that it causes for staff members. Think about the emotional stress that it causes for students, because many of these programs in those funds directly impacted students. And so when we think about undocumented students, and even though this is not a budget issue, it is a policy issue, that has a tremendous impact on how those students are able to learn. And we've seen a direct relationship to the graduation rates of those students, as well as the academic performance. And so what I'll leave you with is that it really is about both cuts and disruption. And when those things happen, it makes it extremely difficult for us to be able to do this work. And so with that, I'll yield back the balance of my time, but I do appreciate just being able to share briefly how these impacts not only impact the functions and operations of the school district, but also the mental health of students and staff members.
Dr. Taylor, we thank you for your leadership for Wake County. More importantly, we thank you for your innovative ideas and how you stretch the thinking of how to provide for our children. I've had many different times where I've seen you present and how just personable you are with the children and the parents in this community. We'll keep you in our thoughts. If there's anything that we can do to support you, know that NAMI North Carolina is here. But again, thank you for stepping up to the plate and ensure that our children are our future leaders. Thank you again, Dr. Taylor.
Absolutely. Appreciate the opportunity.
And last but certainly not least, we have David Ellis, our county manager for the Wake County government. David Ellis has served as interim county manager following the retirement of Jim Hartman on October 27, 2017. Ellis started his tenure with Wake County in February 2015 when he accepted a deputy county manager position. In that role, he oversaw several departments, including health, human services, community services, and environmental services. Prior to coming to Wake County, Ellis served as the assistant city manager in Charlottesville, I learned that, Virginia, for 3 years. He has also held positions in Fairfax County, Virginia, including assistant to the county executive, assistant director of human services, and a manager of redevelopment and housing authority and Department of Code Compliance. Mr. Ellis is a actual guru about affordable housing and different reentry opportunities for here for Wake County. County Manager Ellis, the floor is now yours.
Thank you, Lillian, and thank you for having me tonight. Nami, thank you for putting on this important event. To all the social workers out there, I give it up to you. I started my career as a social worker, and it drives a lot of what I do today. So thank you all for your continued work in the social work field. I'm going to talk a little bit about what's in the Wake County budget. The county budget is about $2.2 billion, lots of line items. But one of the things that's not a line item in the county budget, but is really a core value, is our vision for a thriving Wake County. And so in December of last year, I decided to create a behavioral health department, separating it out from some of our general health and human services, because I really felt like it needed focused leadership, and this was one way to make it happen. In September of last year, the county had its fourth Behavioral Health Summit. We brought together community members, service providers, advocates, and county leaders to develop a shared roadmap of mental health improvement. The outcome of the summit, if you go on our website and look, there's a 2025 through 2028 strategic behavioral health strategic plan, which guides policy, partnerships, and funding decisions. Just some highlights from the plan. It's really focused on expanding prevention and intervention efforts, especially in schools and community-based organizations. We do a lot of work with Dr. Taylor and his team and the children in the Wake County public school system. Reducing behavioral health related incarcerations through diversion programs and crisis alternatives, and building out our service capacity in high need areas by strengthening partnerships with nonprofits, hospitals, and first responders. In this latest budget, the FY26 budget, we reinforced these priorities by directing significant resources to behavioral health. And notably, we're investing in crisis response services. And you heard a little bit about that earlier, that reduce emergency room use and connect people to care. A growing network of community behavioral health providers that are supported through county grants and contracts. And coordination again with the public school system to enhance behavioral supports and reduce youth suicide. We also had the opportunity to our continued investment of opioid settlement funds. We're expected to receive close to $70 million over the next 18 years. And in FY25 alone, we awarded over $6.5 million in opioid settlement funds in grants to community-based providers that focused on recovery, prevention, and treatment access. Some of those programs that were included were medication-assisted treatment in our county detention centers, funding for recovery housing, peer support services, and expanded naloxone distribution and overdose education. Together, we believe that these investments represent a transformation in how Wake County approaches mental health, not as an afterthought, but as a foundation for community, safety, resilience, and most importantly, dignity. Spend a little bit of time on our reentry and criminal justice system. We know that individuals with behavioral health needs are overrepresented in our jails and court systems. So we're expanding alternatives to incarceration to include an increase in diversion programs for individuals with mental illness and substance use disorders, MAT access in our detention facilities paired with reentry support upon release, and case management to connect individuals to housing, healthcare, and employment. And we've gained a lot of support from partners like the City of Raleigh to support cold weather sheltering and long-term planning. In FY25, we launched new housing stability programs in partnership with behavioral health providers to ensure that residents exiting jail, treatment, or emergency shelters are not left without support. So some of the things we do is we pair case management and clinical services with housing placements, provide tenant assistance and landlord engagement to reduce evictions, and we fund bridge housing for individuals awaiting long-term placement, including our Cornerstone Center, which provides 20 units of housing that we operate for people with behavioral health challenges. This has become the model for other developments in Wake County. which in turn, we've reduced our homeless population by 10%. We also recognize the need for upstream prevention to create more affordable housing units through capital investments, land donations, and low-income housing tax credits that help reduce the stress, instability, and trauma that can exacerbate mental health challenges. In last year alone, we invested more than $18 million to support nearly 644 units of affordable housing in Wake County. As part of this work, every affordable housing development we invest in includes a requirement that at least 10% of the units are set aside for residents with behavioral health needs. We're also bringing services directly to where people are. This year, we're launching a mobile recovery clinic at our men's shelter to expand access to care for residents experiencing homelessness. Affordable housing and mental health care cannot exist in silos. Our vision is for every resident to have a safe place to live and access to care when they need it. I will tell you our FY26 budget represents our most comprehensive investment in behavioral health care, housing, and justice reform. But more than that, we're investing in a new system. We're investing in a system that treats people holistically and focuses on outcomes. Our goal is not to just treat the behavioral health issues, not criminal ones. Through strong coordination between our sheriff's office, behavioral health department, public health, and local nonprofits, we're building a reentry ecosystem that helps people succeed, not cycle back through the system. And so just briefly, I'll talk a little bit about what our affordable housing department is doing. Through our Department of Housing and Affordability and Community Revitalization, we deployed through local and federal dollars, including the ARPA dollars, funding federal entitlement grants, including CDBG, HOME, HOPWA, and ESG, our Continuum of Care, coordination for HUD-funded programs that address chronic homelessness, county investments in permanent supportive housing, vouchers, rapid rehousing, and housing navigation. Just a little more on our Continuum of Care. In late 2024, the Wake County Board of Commissioners voted to approve an agreement that officially transitioned the Wake County lead agency in supporting unhoused individuals in our community and the agencies that help connect them to shelter services. And so the Wake County Continuum of Care is now a department in the Wake County government. We're bringing together local nonprofits, government agencies, housing developers, healthcare providers, and people with lived experiences to coordinate support and housing services for those experiencing homelessness. The COC has one goal: to ensure that homelessness is rare, brief, and non-reoccurring. And so a few things since we've been named the lead agency. We've signed a 5-year agreement with the COC to formalize responsibilities, hired a full-time director who was a deputy COC director in Washington, D.C., to help lead the transition and build a strong team. And we secured key HUD grants in state to improve our operations. And so, as you can see, your county is working extremely hard to provide a comprehensive system that allows people to have their needs met no matter where they are on the spectrum. And I am proud and blessed to be a part of that. And we have a team of wonderful people. And the folks in the community are so supportive of the work that's being done. And that's what, to me, that's the best part of it. So thank you for your time.
County Manager Ellis, NAMI, North Carolina, had the opportunity to sit in that behavioral health summit. So we are proud that we are a participant in the Wake County Community Health Needs Assessment. So if you have not reviewed the new Wake County Health Needs Assessment, please go out and review it and see what our key priorities are for the county. But most importantly, we are a partner and a recipient of funding for Live Well Wake. So we have received some great support from Marcellus and his team at Live Well Wake. So you're doing great things, and we'll continue to be there. If you need us, please know that we're more than happy to support the county. Thank you again.
Thank you.
And we have a surprise for you, County Manager Ellis. We reached out to one of your major partners, CASA. So we have joining us tonight Latrice Hines, the Director of Property Management. Latrice Hines serves as the Director of Property Management for CASA and has been with the organization since 2017. In her role, she manages CASA property managers overseeing over 50 properties. She maintains all aspects of property management to ensure succession of properties and ensure vitality of CASA's mission. In her own words, Latrice loves working at CASA to assist in achieving its mission to end homelessness. She has a passion for helping those in need, and CASA provides the opportunity to do so. Her goal is to be the person she would want to encounter if she needed safe and affordable housing. CASA has reached out to NAMI to do some more partnership opportunities in the future. So we wanted to bring to you tonight a resource for those that have a family or loved one that needs secure housing. Ms. Hines, are you joining us today? If so, you'll have to come off mute for me. Let's see. All right. Okay, if she's not here today, we will provide more information. We have different links and informations and some initiatives that are coming down the pipeline for Wake County. So we will provide a link for you to receive more services. But again, it is called CASA, and they do provide properties and ensure the vitality of those of addressing the need for safe and affordable housing here in Wake County. So we'll circle back around to see if she has some issues. I know there's a storm, but we'll see if she joins us later before we conclude. Now to move on to another great legislator who has been a very support system for NAMI North Carolina. We recently did legislation with him and came to the table for the Coach Cares Act. He has been addressed as the young senator, Senator Thedros, but you tell them young with a mighty voice. He is representing Charlotte, North Carolina. He is the son of immigrants. His life has been shaped by a deep respect of hard work, equity, and public service. Before entering public office, he worked in business and data analysis, where he focused on economic development and practical problem solving. He also spent years in grassroots organizing, fighting to make government more responsive to everyday people. He comes from a list of political leaders within his family dynamic. In the Senate, he focuses on expanding access to mental health care, supporting seniors, improving public education, and opening up economic opportunities, especially for communities that have long been excluded. He hails from Charlotte, North Carolina, but most importantly, he is our voice at the General Assembly. I love when I'm there visiting as a lobbyist to see him stand up on the floor and interrupt, but he comes with the mighty punch. Again, Senator Thedros, thank you so much for joining us tonight. Please tell them how we've supported you and tell our attendees tonight more about the Coach Cares Act.
Yeah, thank you so much for that, Lillian. Mental health has been probably definitely a cornerstone of some of the legislation I've been working on. And I don't know whether it's necessarily generational, but, I tend to think that as society progresses, and this is something that everyone here agrees on, that as society progresses, the only sort of area within society that I don't necessarily think we're moving forward is mental health. And so this is why it was a big part of my political platform and an area that I'm looking to push forward, whether it's through legislation, whether it's even through proper implementation of policies we already have on the books. And so NAMI has been a wonderful partner here. And I just met with members of the South Carolina group as well in trying to figure out how do we push legislation like the Coaches Care Act. And so coming into the state Senate, I've only been here for about 6 months. Despite Democrats being in the minority, I still wanted a way to push policy forward, whether it was through a bill or specific regulation, statute, et cetera. And so among the bills that were related to mental health that we're pushing is something called the Coaches Care Act. Like even many folks on this call, kids going through sort of that pivotal time in their life, a coach has the tendency to play a very big position, especially in Charlotte, where I represent a big African-American community. There are a lot of folks that are spending, whether it's every Saturday or some of these pivotal times with coaches, that they're oftentimes kind of the adult figure in their life. And so what the Coaches Care Act tries to do is make it a mandate for all those who are coaching within K through 12 and especially high school, to take the mental health first aid training, as you all know even more than I do about the training. And so this is, not there to essentially make therapists out of all coaches, but to actually inch them a bit closer to realizing sort of the impacts of mental health, especially whether it's North Carolina or even across the country. We know that nearly 1 in 5 sort of youth aged about 13 to 18 experience severe mental health disorder. And oftentimes they're gone unheard, nobody's there to notice, etc. So by giving certain tools to some of these coaches and having it as another requirement, kind of inches us a bit closer to having a kid realize the importance of their mental health very early on. And so oftentimes our fixes are later on in a kid's life, whether they have to start going to therapy, etc. But if we can start getting that sort of close figure to a kid and provide them a little bit of resources early on, we'd be a lot better shape. And, realizing the political realities here, this is a policy that doesn't necessarily take a ton of funding, given that the training is relatively cheap. And so how are we trying to push this across the finish line? So Lillian and many other folks that are helping with this process were here about a few weeks ago in the General Assembly, where we met with many Republican leaders to try to get buy-in, and they were great conversations. Senator Phil Berger has indicated has expressed his desire to help in this as well, along with Senator Bergen and many of the leaders within the healthcare committee. And so we're taking sort of a three-pronged approach here. One, best case scenario, which I'm probably the most optimistic for, is just to pass the actual law. And I think we have gotten some reassurances from Republican leadership that this is something that will be able to move across the finish line. And so the second part, sort of a plan B here, is look at the already existing regulatory framework and to see how we can make that a requirement without statute. And so there are many boards in existence right now that come out with rules for how coaches must conduct themselves. And so whether that's the recent concussion protocols that they implemented that coaches must now be aware of, this could be another added training. And so we're working with a staff member in Senator Bergen's office who's focused on healthcare to see whether we can go directly to, I forgot their name, but the governing body for high school sports, so we can implement that. So third would be expansion. What happens after we push this along? And so the first sort of marker we're trying to push across the finish line is, can we get coaches K through 12? Second is, we can't necessarily regulate private leagues, but any league that uses public land or parks and rec can have that mandate as well. And then lastly, this is something I have tried to do locally, but I think it should be a requirement for every teacher to have taken the mental health first aid training. And so this has received bipartisan support, as many of you all know. In the state of Florida, which is run by Republicans, there is a requirement for all teachers to have the mental health first aid training. In North Carolina here, we have both qualitative and quantitative studies to show the kind of impact that it has with teachers, along with seeing different sort of professions that have had this as a requirement as well. Here in Charlotte, the police force, everyone who becomes a member of the police force needs to take the training as well. So I think the logical conclusion here is to have every teacher taking the training as well. And so this too, I'm extremely optimistic about. I've had a couple conversations with Republican leadership, and they've indicated even their desire also to push this new mandate on teachers as well. And so, we're going to receive pushback at the end of the day. Like, the idea is teachers should not be therapists. Yes. In a perfect world, as a matter of fact, we would have 2 or 3 therapists per classroom. But that's just not the reality we're in. And so while I can continue to push legislation, as I have introduced even additional resources for therapists in school, I don't want to sit on my hands, frankly. I want to ensure that we're continuing to progress. So that's why there's also a push to have every teacher have this training as well. Not because we have the expectations for them to be therapists, or not because even that this is the best idea out there to solve mental health, but it inches us a bit closer. And as everyone who works in this field knows, that there is no silver bullet. There's just incremental progress we can try to make with every piece of legislation and everything that we can kind of advocate for. So that's essentially all I had, Lillian. Let me know if there are other topics that you want me to cover, but thanks so much for having me on this call.
Thank you, Senator Tedros, for everything. Thank you for your support. Thank you for calling me and putting me through my first press conference. So I really enjoyed it to put that on my tool belt, but more to come. We're enhancing our grassroots efforts this year, and I'll be more than happy. Anything you need from NAMI, you know I'm there to support. Thank you again for everything.
Excellent. Thanks so much.
I was just aware that we have another legislator that represents District 33. We have Representative Monica Johnson Hostler. She is a proud representative of District 33, which is Wake County. We have supported her bills for House Bill 245 for affordable housing, House Bill 420 for sound basic education for every child. I just wanted to give respect where respect is due and to give her the opportunity to greet Wake County tonight. Representative Hustler, are you here?
Yes, I am, Lillian. Thank you very
All
much.
right, I'm gonna allow you a few minutes to greet your constituents here in Wake County.
Thank you so much for allowing me to wrap us up and thank the people from Wake County who've joined. But thank you first, Lillian, for your advocacy and the work that you've done. And you've truly made a huge impact, which people have heard tonight with your work with both Representative Hawkins and Senator Tedros. It is my pleasure to greet you all from here in Wake County. Again, as Lillian said, my name is Monica Johnson Hostler, and I am the proud representative of District 33, which is South Raleigh and Garner. This is my freshman year, and so prior to that, as many of you know here in Wake County, I served 11 years on the Wake County School Board and dedicated my tenure there looking at ways that we could continue to protect our children, especially our most vulnerable and those who've had lived experiences of trauma and mental health alike. To that end, that was a cornerstone and will remain a cornerstone of all of my priorities as a state legislator to ensure that not only are we working to pass bills and policies and practices in our state that ensure that we have access and enhance the services of mental health throughout the county, it is also important to me that we acknowledge that in addition to us talking about mental health is health. And as you heard Dr. Taylor say it very well, if our students aren't well and cared for, then they also are not learning. The data supports for us that if we can help our students prevent adverse childhood effects, especially those who suffer from mental illnesses, that we have a greater chance of they graduate on cohort. So while we do not have a budget, it was a huge priority for me this year to work very closely with our majority leaders on education appropriation to see increases in the services that we provide to our special education students in our public schools. I had the opportunity to see the gravity of which we serve our students, and most people don't know the work that our public schools do to serve our children. The highest case study that we have for our students is $26,000 per student for our students with the highest needs in public schools. And yet our state has not increased the funding for special education for our students and our educators in well over 20 years now. And so we did see a little needle move that came out of the House budget in education appropriation with a significant amount of advocacy, and thank all my public school allies for showing their advocacy and supporting the efforts to increase that funding. So I'd be remiss if I didn't say that while we don't have a budget and we are currently adjourned briefly, advocacy and moving policy doesn't stop. And so I encourage those of you who are acting and being in action, along with those of us on this call, that you share broadly and be ambassadors for the change that we need to see in our budget to ensure that we are not just addressing mental health through our policies, but we also are making it a budget priority, because what we put in our budget are the cornerstones of what we believe in our state. And so again, thank you, Lillian, and everyone who are working on behalf of our students and families in North Carolina to ensure that those who need the mental health services have access to them, and those who yet still suffer from stigma, we are beginning to break those barriers by ensuring that we're socializing and normalizing the need for services. So again, thank you for allowing me to join you, and thank you for the work.
Thank you, Representative Johnson Hostler. You were great for our advocacy day. You went with us to committee meetings. You shut down your day to be a support to NAMI North Carolina. I thank you with questions that I had, learning how to be in this lobbyist role. You were more than willing. with Senator Blue to help and assist. So we are here again if you need us, and we will be doing more advocacy work in this year. Thank you again.
Thank you.
All right, to now I'll pass it back to my colleague, Amy Brundle. She is going to help us address any questions that we have in our chat or our Q&A feature. Amy, I'll pass it to you briefly.
Sure. Thank you so much. And thank you again to all of our esteemed speakers tonight. All of this has been really enlightening and ultimately hopeful that we're all moving in the right direction and on the same page. So thank you all so much for your time. One question that I'll address really quickly, I think my executive director, Holly, put this in the chat, but just in case it got pushed up a little bit, I'm going to put it again. If you'd like to keep informed with things that North Carolina DHHS or NAMI North Carolina are doing, webinars, newsletters, etc., please subscribe. DHHS puts out a Hot Topics. I think it's kind of weekly, but it's also just kind of when you have something to report, twice a week. Okay, so there are very frequent updates there, and then NAMI North Carolina has a monthly kind of full recap newsletter and then various events going on throughout the month. So if you'd like to be involved in any of that, please subscribe. Those are the links there. And then we have a couple of questions that I'll take from the audience. One of them is, what initiatives is the state pursuing to expand Medicaid billing codes for prevention-focused services, especially those delivered at intermediate levels of care, such as primary mental health, intensive outpatient programs for individuals at risk of crisis? And whoever feels most equipped to handle something about Medicaid billing codes, please feel free to jump in.
That's actually a really tricky one because Medicaid doesn't pay for prevention. That sounds really strange, but it's true. We get a lot of federal funds through our division for mental health and substance use services, and typically those are for things that Medicaid cannot pay for, right? Guess what we're not allowed to pay for either? Mental health prevention. It's one of the things we've been working and advocating for at the federal level for a very long time. Oddly enough, we are able to pay for substance use prevention, but not mental health prevention, like mental health wellness. A lot of people mention like mental health first aid. We can't pay for mental health first aid training even. Now, that doesn't mean that we're not creative and we try to find the gray in those rules and also use state funding, because you're absolutely right. But I heard a lot of things tonight that are really, really important, like kids, let's keep kids from needing therapy, right? And so it's fine if they do. There's zero wrong with that, right? I'm a therapist. It's great. But if we are doing more to make sure that teachers are equipped, families are equipped, churches are equipped, coaches are equipped to have meaningful conversations and to notice when folks need support, that's super, super important, and that's prevention. So yeah, it'd be great if Medicaid could cover those things. It'd be great if federal dollars could let us cover those things, but we are trying to find really creative ways to equip just families and community organizations to be able to have meaningful conversations and support kids. Yeah, so our strong preference is for kids not to need treatment. Again, nothing wrong with treatment, but let's try to help them grow up in healthy, great communities.
Yeah, thank you, Kelly. That's a great answer. We had somebody ask, how do we help encourage the unhoused, the addicted to substances, the severe mental illness population that's going to be impacted by the new executive order regarding the unhoused and the homeless situation in most of the country? How do we give them encouragement to still seek help without feeling they may be forced into treatment against their will?
I'd say the important thing is that I keep reminding my staff and my team is it's an executive order. That's all it is right now. It's I'm going to say it because it's after 8. It's ugly. It's ugly and hurtful. And but there's nothing like I haven't gotten any funding direction, like we can't fund certain things, or we can't fund a housing program unless someone gets treatment. We can't do that anymore. This we did 100 years ago, and we did so much damage. So we'll wait to see. We'll wait to see if things like HUD funding changes. But the other thing I want to assure folks is that laws around commitment are at the state level. And we've been working for a couple of years. We haven't made a lot of progress, let's be honest. But man, we're going to make some to amend our involuntary commitment laws here. We're going to try really hard. I'm going to ask all the wonderful legislators here to help us, because people and families of kids should choose if they want to have treatment or not. They shouldn't be forced to have treatment. So I understand that the EO is very concerning, but we're going to do everything in our power to remind people that they have the dignity of choice, and they can choose to receive treatment or not in a variety of ways, like peer centers, where they may feel a heck of a lot more comfortable receiving treatment than at a clinic or a hospital, and that's cool too. So yeah, I mean, we don't want the executive order to make people afraid. They're afraid now. They're afraid now they're going to get locked up, and it happens far too often in our community. But we are working actively against that to make involuntary commitment rare, and to make sure that people have comfortable places for treatment of their choosing.
Yeah. We have a question. We'll see who feels most equipped to answer this one. There are people with mental health and developmental disability diagnoses who depend on the ACA. This person's asking, what will happen when the vouchers go away in December?
I don't know. I really don't know. That's a good question, but I will remind folks, this is not ideal. What I'm about to say is not ideal, but I'm going to say thank you to our legislators for the continued state dollars they give us to help people without insurance. Before 18 months ago, before expansion, that's what we relied on. We relied on those dollars to support everyone who did not have Medicaid. So we still have that safety net of dollars, that safety net of services. And another positive note, Congress just reauthorized all of our federal mental health and substance use funding, and they even upped the substance use prevention, treatment, and opioid funding, not the mental health funding, but definitely all the others. That's wonderful. So no reductions in that. And we also use this to help folks who don't have insurance. It is not what we want to hear, that people might lose their vouchers. That is not, that's awful, but we will keep working with our state dollars and with our other federal dollars to support mental health, IDD, dual diagnosis services for folks who may lose their insurance coverage. We support those people now. There's still a lot of people that don't have insurance.
We just have a couple more questions. One is, does anyone have any advice for a second-year Master's of Social Work student that would like to work as a policy social worker? Oh, you might.
I'll put my email in the chat. You can contact us about an internship. I'm not even kidding. Like, I didn't know what it meant to work for the government. So internships are great. We try to get as many interns as possible because it's really even hard to explain policy. So we love social workers interested in policy, but honestly, that's what I would recommend. Try to get an internship at county, state, government, with the legislature, governor's office.
I'd certainly say have them to come and work in social work in public schools so they can get the experience to better guide policy work when they do so.
I love it. I always tell students that, Dr. Taylor, you're so right. Like, I was a clinician in the community for a very long time before I did policy. I think that's really critical to like live and work in it. I do think it really helps do better policy.
Okay, and then on the last question, which I feel like I know the answer to because we do this as well, are there opportunities for you all at the state level to partner with state and local collaboratives? And are you actively doing that work?
All the time. All the time. We release funding, but we also just, for community organizations, right? But we don't always have to fund the community organizations because we have our funding and you have yours and you have our mission and we can all work together. So I probably spend, and I'm just speaking for myself, not the other esteemed folks here, I might spend 3 or 5 of my days out in the community at local coalitions because that's truly where the work gets done. That's where we listen, we learn, we find ways to work together. So yeah, feel free to reach out. If we do not work or know you already, we would love to. I mean, that's what we do with NAMI. Y'all, they all rock. So yeah.
Well, I think that's all the questions that we have for today. We got a lot of great comments just thanking you all again for your transparency, your honesty, and your passion, your tangible passion for this kind of work. So thank you all so much for joining us tonight and for sharing about your work and about your priorities for mental health as we're going forward. Lillian, do you have any closing comments for us tonight?
I do, Amy. Thank you again to all of our amazing speakers here tonight, our legislators that supported us tonight, and to you, our attendees. We can't do this without you. Your voice, we are your voice at the table. We want to make sure you all have a place at the table. I would be remiss if I didn't thank my executive director and my NAMI colleagues. You're dear to my heart. I thank you so much. You rock. You're the best colleagues I've ever had and friends. And to Director Crosby, another friend, but a mental health advocate here in North Carolina, we thank you for your partnership and from taking my Post-it note to making it into a beautiful experience tonight. So again, thank you. And what's next? Advocacy work. There is a way I learned for everyone to use their voice. Whether you are a person that does not like public speaking, whether you're a better writer and can do a writing campaign, there is a way for each of us to make sure our voice and our expertise is heard. We need you. Our country needs you. Our state needs you. We will be reaching out to make sure that we are band together to make sure that everything we do moving forward, our democracy hears our voice, and that anything we do is inclusive for all. NAMI North Carolina thanks you. We will continue our work together for the state of North Carolina. We thank you all again for joining us tonight. Thank you again and have a good evening.